Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and this is COVID-19 World News. This presentation is the first COVID death after COVID-19 vaccine. Let us learn a little more about this incident because it is of great importance to each and every one of us who are taking the vaccine. The first death was reported in the USA Today on January 6, 2021, and this was reported to be due to low platelet count. We'll get back to low platelet count. I want to emphasize the fact that more than 5.1 million people right here in the United States have received the vaccine, and this is the first death that has been reported in a patient who had received COVID-19 vaccine. It was a Pfizer vaccine. What is low platelet count? What is platelet to begin with? If you do a blood smear and put it under the electron microscope, you're going to see these disc-like structures known as the red blood cells. Then we have these large cells with multiple nuclei, and they are known as the segmented neutrophils. And in between them, you see little fragments of these little specks, and those are known as the platelets. Platelets are involved in clotting. If you cut your skin or something, the platelets come into play to produce a clot. So the platelets are supposed to prevent you from bleeding. In fact, we give anti-platelet agents for patients who have these coronary stents so that they don't develop any blood clot that can block off the artery. But in this particular patient, what he developed is known as ITP, or idiopathic thrombocytopenic purpura. It's a pretty fancy word, but it simply means little blotches of skin discoloration due to bleeding underneath the skin secondary to low platelet count. That's what ITP means. ITP can occur in a number of conditions. Let's talk about the information that was reported in the USA Today on January 6th. He was a physician, 56 years old. He developed low platelet counts 3 days after the vaccine administration, which is called as idiopathic thrombocytopenic purpura. He was hospitalized for 2 weeks. Nation's experts on blood clotting and platelets tried everything to increase his platelet count, but he eventually succumbed to death from hemorrhagic stroke. And he was doing reasonably well until he developed this hemorrhagic stroke, according to the report in the USA Today. And it also said that he developed these skin blotches or rashes 3 days after receiving the vaccine. We have no information about his past medical history, his past medical blood counts, whether he had a genetic factor, and none of that information is available. So we cannot in any way conclusively determine if this was caused by the vaccine and if this was related to the vaccine. We simply have an incidence of death in a patient who received the vaccine, and that is related to the low platelet count. Let's learn a little bit about what is ITP, or idiopathic thrombocytopenic purpura. I already described to you little blotches on the skin, like bleeding under the skin, and this discoloration can appear in different parts of the body. But this is not the first time we have seen this ITP. It has been seen with vaccines related to measles, mumps, and rubella. It has also been seen in patients who are having cancer, anemia, any type of virus infection. There could be some genetic predisposition, toxic chemicals, and of course medicines like diuretics. And as a cardiologist, we use heparin in patients who go for heart catheterization or heart surgery. And I have seen cases of people developing ITP after heparin administration. So this is not something that is happening out of the blue. It is recognized in certain conditions. So this is a known factor. The question is, any death in patients receiving vaccines is a major concern, but not all deaths may be related to the vaccine. Let me underscore that. Any death related to a person receiving vaccine is a major concern, but not all deaths may be related to the vaccine itself. It needs extensive history evaluation, it needs extensive research, it needs extensive analysis of the data to conclude that vaccine was the cause of this idiopathic thrombocytopenic purpura, which led to the death in this person. But we don't have any of that information, so it is premature to conclude that the condition caused the death and that was due to the vaccine. We simply have a set of conditions where a person received a vaccine, he developed a low platelet count, he unfortunately died from hemorrhagic stroke. But until all the information is gathered, we just have dots, and all those dots need to be connected. Let's remember, millions of people receive vaccine. When these tests are conducted, they are done on like 30, 40,000 people. When you give vaccination to millions of people, they all respond differently to the vaccination. And a lot of these people have different underlying medical conditions, like the ones which I talked to you in the previous slide. They all respond differently, and some people do develop some side effects, allergic reactions, anaphylactic reactions, or something like the ITP. But until we have gathered all the information, all we can say is that there is incidence of a death in a patient who received the vaccine and who developed idiopathic thrombocytopenic purpura or ITP. That's where we can really stop, because we cannot say anything beyond that because we don't have all the information. So it is very important to realize that we should not be making judgments based on inadequate information. But nonetheless, vaccines are generally safe. I have taken the vaccine myself, and I do recommend vaccine for the frontline workers, healthcare workers, and also those who are about 65 who have multiple risk factors or even one risk factor. Having said that, I would like to conclude my presentation on this first death reported in a patient who had received vaccine. So we need to be very careful about the terminology. In the meantime, you can check out my COVID-19 pandemic, an international guide to a pandemic, which is on Amazon.com. And until next time, I am Dr. NIK NIKAM. Thank you so much for watching, and please do subscribe to our YouTube channel.